Yeah, so the CLL, you're correct. Actually, one of the earliest CAR reports coming out of University of Pennsylvania was actually for CLL patients. This was almost more than 10 years ago, where they give CD19 CARs to these adults with refractory CLL, and in fact, they updated the data, a 10-year data, a few months ago, where they were able to detect CARs in these patients 10 years down the line, and these patients were in remission. So really a spectacular, fantastic results. So there was a lot of interest, going back to 10 years ago about generating CARs for CLL. But the subsequent trials, larger multicenter studies, have shown that the efficacy of CLL CARs have not been as high as we have seen in non-Hodgkin's lymphoma, as we have seen in ALL, both children and adult ALL. So still ongoing, there are several trials which are ongoing specifically for CLL. There's a CAR product called Lysocell, which is made by BMS, and that has been reported many times at the ASH meeting and other meetings where they have treated several patients with this CD19 CAR. So these are autologous CAR. Now, one of the possible reason of less efficacy for CLL patients is that we know that the T cells from patients with CLL are dysfunctional. They have a more expression of PD-1, CTLA-4, other checkpoint inhibition molecules which make the T cells dysfunction. So it's possible that if you're generating CARs from these patients' own T cells, which in a patient with CLL are very dysfunctional, when you make the CARs out of them, they're not that good or they're not that robust to say. And in that space, an allogeneic CAR derived from a healthy human being who presumably has a good functioning T cells will be a better product coming out of those T cells as opposed to the patient's own T cells which are dysfunctional. So that's I guess it's a theory which many investigators believe is kind of maybe one of the reasons. So I think the allogeneic CAR field is still evolving slowly, but as I said, there are several companies now looking at CLL and Richter's transformation for allogeneic CARs as well. So we'll have to see. I think again in the next 1 to 2 years we'll know more about updates on the autologous CARs for CLL, and then also allogeneic CARs in the context of CLL.